Legionnaire's disease is a severe form of pneumonia caused by the bacterium Legionella pneumophila. First, a vital correction. Legionnaire's disease is not a virus. It is caused by a bacterium that thrives in warm, stagnant water systems. It is transmitted when people inhale microscopic aerosolized water droplets. Crucially, it does not spread through person-to-person contact. Legionella pneumophila is a gram-negative, rod-shaped bacterium. Unlike viruses, it is a living organism that thrives in specific aquatic environments. The organism's growth is temperature-dependent. It flourishes best in warm, stagnant water ranging from 25 to 45 degrees Celsius. This range is critical for its colonization. Legionella commonly colonizes complex building infrastructure. Inside pipes and cooling towers, it forms a protective biofilm. This biological slime acts as a shield, making the bacteria highly resistant to standard cleaning and chemical treatments. Legionnaire's disease typically presents as a severe form of pneumonia. Symptoms often manifest within 2 to 10 days of exposure and include a high fever, a persistent cough, and significant shortness of breath. It is critical to distinguish this from Pontiac fever, a milder, flu-like variant. While Pontiac fever is self-limiting and resolves without aggressive treatment, Legionnaire's disease is far more dangerous and frequently requires clinical intervention. Certain groups face a substantially higher risk of infection and complications. These include individuals aged 50 or older, smokers, those with pre-existing chronic lung conditions, and individuals with compromised immune systems. The regulatory landscape for Legionella control has undergone a fundamental transformation. Following repeated urban outbreaks, jurisdictions worldwide have shifted from purely voluntary guidelines to mandatory enforcement. At the forefront of this shift is the ASHRAE 188-2026 standard. This benchmark mandates that all large commercial and residential buildings implement a comprehensive water management program. These programs are no longer optional checklists. They require the formation of a dedicated water management team to conduct systematic hazard analysis. Building owners must define precise control measures and maintain documented verification, creating a direct path to legal accountability. By tying environmental safety to legal accountability, modern regulations ensure that building owners prioritize water health. Outbreaks are treated as engineering failures, reinforcing the standard of professional stewardship. Rising global temperatures are significantly expanding the geographic range of Legionella bacteria. Historically, these bacteria thrived in specific warm water systems. However, as ambient temperatures increase, water systems that were once considered safe or cold are now reaching the optimal thermal range for bacterial colonization. Research shows that bacteria are colonizing environments previously considered safe zones. Increased humidity and unseasonably warm winters are allowing these pathogens to persist in infrastructure far beyond their traditional summer peak. We are observing longer Legionella seasons. Public health strategy is shifting from summer-only vigilance to a year-round monitoring cycle. This requires constant facility management to prevent bacterial blooms during previously colder months. Preventing Legionnaire's disease requires a shift in perspective. Instead of treating only the patient, we must treat the building itself as the patient, maintaining its water systems to ensure they remain safe and resilient. 3 primary strategies form our defense: regular flushing of unused pipes to prevent stagnation, maintaining high thermal temperatures, and utilizing chemical shocks to eliminate biofilm. By adopting environmental stewardship, we recognize that Legionnaire's disease outbreaks are engineering failures. Consistent, proactive maintenance ensures the building stays healthy, protecting every occupant inside.